Have you ever been told to take your vitamins daily because it's the smart, healthy thing to do? What if I told you that one of those vitamins, taken with good intentions, could quietly be setting you up for a life-altering stroke? I'm Dr. Jen, a neurologist who has spent more than 3 decades studying the aging brain, and I have seen too many seniors suffer brain bleeds, blood clots, and memory loss not from poor lifestyle choices, but from the very supplements they believed were protecting them. This video is not about fear. It's about truth. The truth that every pill, every supplement, every bottle you pick up at the store carries real power, and in some cases, real danger. Especially after age 60, your body processes vitamins differently. Your kidneys, your liver, your blood vessels are no longer as resilient. What once worked in your 40s may now work against you. So today, I'm going to walk you through 5 popular vitamins that could quietly increase your risk of stroke overnight. You'll hear real patient stories, clear scientific explanations, and most importantly, safer and smarter alternatives to help you protect the brain you rely on every single day. But before we dive in, I need you to do something that could save a life. If you're over 60, or if you have a parent, a friend, a neighbor in that age group, hit the like button, subscribe to this channel, and most importantly, share this video, because strokes often happen in silence, and one small change, one bit of awareness, can mean the difference between a normal morning and never speaking again. This isn't about scaring you, it's about equipping you. So stay with me until the end. The most shocking discovery comes in the final section, where I reveal a popular vitamin that has caused sudden blood vessel spasms in the brain with no warning at all. Now, let's begin with the sunshine supplement that might be doing more harm than good. Part 1. Vitamin D, the bone saver turned brain threat. Vitamin D has been hailed for decades as a miracle nutrient, crucial for bone health, immune support, and even uplifting mood. Doctors prescribe it, ads promote it, and many older adults take it religiously. But few realize that this seemingly harmless habit could be silently turning into a neurological time bomb, especially after age 60. You see, vitamin D isn't just a supplement. It's a hormone-like compound that influences calcium absorption and vascular tone. In moderation, it helps. In excess, it hardens arteries, spikes blood calcium levels, and raises the risk of brain bleeds and clots. Particularly in the early morning hours when your body is dehydrated and your vessels are under stress. Let me tell you about Mr. Thomas, a retired Navy veteran, age 74. He was the picture of discipline. Every morning he lined up his vitamins, and among them, a 10,000 IU dose of over-the-counter vitamin D. He thought it was helping his bones stay strong. What he didn't realize, this dose, taken daily and unsupervised, was slowly stiffening his arteries and placing silent pressure on his brain. One morning, his wife found him slumped on the kitchen floor, unable to speak clearly and dragging one side of his body. He'd had a stroke in his sleep. Blood tests later showed toxic calcium levels and severe arterial calcification. This is not rare. Most seniors don't feel the buildup. There are no warnings, no pain, just a sudden event, a collapsed morning, a slurred sentence, a permanent loss of independence. The truth is, after 60, your body does not flush out excess vitamin D easily. It gets stored, and when paired with calcium or taken at night, it can be especially dangerous. The dangers include brain vessel calcification, unpredictable blood pressure swings, increased clot risk in the brain. What can you do instead? Only take vitamin D if you're truly deficient. Get blood levels checked at least twice a year. Limit intake to 600 to 800 IU daily unless your doctor recommends more. Always take it in the morning. Avoid pairing with high-dose calcium without supervision. Remember, more is not always better. What helps your bones should never harm your brain. Stay cautious, stay informed, and let your vitamins work for you, not against you. Part 2. Vitamin E, the heart helper that bursts blood vessels. Vitamin E is often praised for its antioxidant properties. It's been labeled as a natural protector of the heart, the skin, and the immune system. And while there's truth to its benefits, the full story is rarely told. What happens when this vitamin, taken in the name of health, pushes your blood too far? I'll never forget the case of Mrs. Eleanor James, an 81-year-old retired librarian from Ohio. Sharp, articulate, and always proactive about her health. She was on a blood thinner for a heart valve condition. Without consulting her doctor, she added an over-the-counter vitamin E supplement she read about in a health magazine, 800 IU daily. 3 weeks later, she arrived in the ER with sudden confusion, vomiting, and slurred speech. A brain scan revealed a hemorrhagic stroke. No trauma, no sudden blood pressure spike. The cause? Her blood had become so thin from the combination of warfarin and high-dose vitamin E that a small vessel in her brain burst. Vitamin E, especially in large doses, acts like a natural anticoagulant. If you're already on medications like aspirin, Plavix, or warfarin, combining them can quietly push your clotting system over the edge. And as we age, our vessels become more fragile, our platelets slower to act. That combination is a recipe for internal bleeding. The tragedy is that most people don't know this. Supplement bottles don't carry bright red warnings, and seniors looking for a memory boost or heart support often never realize the gamble they're taking. Warning signs to watch for include sudden dizziness or nausea, easy bruising or bleeding gums, headaches that come on quickly, any new confusion or coordination issues. Safe guidelines. For adults over 60, stick to 15 milligrams or 22 IU daily. Avoid doses over 200 IU unless specifically prescribed. Never mix vitamin E with blood thinners without medical oversight. Mrs. James survived, but her life changed. She now walks with a cane and requires support for daily tasks. Her memory isn't what it once was, and her family will forever wonder what might have been different. The lesson? Vitamins are not candy. They are potent compounds that can heal or harm. And when it comes to your brain, you cannot afford to play roulette with your health. Now, if that shocked you, what comes next might be even more surprising. There's a common vitamin marketed for energy and nerve health that could be silently robbing you of your balance and mobility. Let's explore that next. Part 3. Vitamin B6, the energy booster that sabotages your balance. Vitamin B6 is often included in brain boosters, nerve support supplements, and senior multivitamins. Marketers say it helps with energy, memory, and circulation. But what they fail to mention is this. Too much vitamin B6 can cause irreversible nerve damage, especially in older adults. Take the case of Harold Carter, a 76-year-old retired truck driver from Kansas. He came to me complaining of a strange tingling in his feet, frequent stumbling, and what he described as pins and needles in his hands. At first, his family thought it was just aging or early arthritis, but his symptoms grew worse until he fell in the bathroom and hit his head. His supplement routine? A nerve health product advertised on TV. It contained 100 milligrams of vitamin B6 per tablet. He'd been taking 2 tablets a day for over a year. That's over 1,400% of the recommended daily amount. Unlike other B vitamins, B6 can accumulate in your nervous system. It slowly wears away at the protective sheath around your nerves, like peeling insulation from an electrical wire. This leads to loss of coordination, numbness and weakness, muscle tremors, balance problems, and here's the scary part, the damage is often permanent. Mr. Carter was fortunate. We caught it early enough to stop further decline. But he never fully recovered. Today he uses a cane, drives only short distances, and regrets not questioning the pills he trusted. Key safety guidelines for seniors. Stick to 2 to 10 milligrams day unless prescribed more for a deficiency. Check all labels, especially combination supplements. Avoid long-term use of high-dose B6 products unless under medical guidance. Many seniors confuse symptoms of B6 toxicity with natural aging, but this isn't aging. It's preventable, supplement-induced nerve damage, and it's avoidable. Next, we'll uncover a vitamin commonly found in eye health supplements that can silently raise pressure inside the skull, mimicking a stroke. Stay with me. Part 4. Vitamin A, eye support with a dark side. When we think of vitamin A, we think of bright eyes, healthy skin, and a strong immune system. For decades, it's been the go-to nutrient for protecting vision, especially as we age. But what if the very supplement meant to keep your eyesight sharp could actually be increasing pressure inside your skull, damaging your brain from the inside out? Let me introduce you to Lillian Moore, a 79-year-old retired piano teacher from Oregon. Lillian had always been independent, graceful, and mentally sharp. She loved music, and even in retirement, she continued teaching neighborhood children how to play. But one autumn morning, Her daughter noticed something was wrong. Lillian was slurring her words, seemed disoriented, and said her vision had become blurry over the past few days. At first, doctors suspected a stroke, but the brain scan told a different story. There was no clot, no bleed. Instead, there was dangerously high intracranial pressure, a buildup of fluid and swelling that mimicked the symptoms of a brain tumor. The diagnosis? Pseudotumor cerebri. The culprit? A high-dose vitamin A supplement Lillian had been taking for over 5 years. It was marketed for vision support, and she took it faithfully every morning, believing she was safeguarding her eyes. But the truth is, vitamin A, especially in its retinol form, is fat-soluble, which means it doesn't leave the body easily. It accumulates. And when your liver, kidneys, or vascular system slow down with age, that buildup can become toxic. Over time, excess vitamin A can increase the pressure inside your skull. It compresses delicate brain tissue, disrupts fluid flow, and causes symptoms that mimic serious neurological conditions. If left unchecked, it can lead to permanent vision loss, severe headaches, confusion, and even cognitive decline. Warning signs of vitamin A toxicity include blurred or double vision, persistent headaches, especially in the morning, dizziness and disorientation, nausea or vomiting not explained by illness, eye pain or pressure behind the eyes. Here's what you need to know. The recommended daily intake of vitamin A for adults over 60 is around 2,500 to 3,000 IU. Many vision support supplements contain 8,000 to 10,000 IU per serving. The safe upper limit is 10,000 IU, but long-term use, even at that level, can cause harm. Retinol, animal-based forms, build up faster than plant-based beta-carotene. Lillian eventually recovered with medication, lifestyle changes, and the discontinuation of her supplement. But her balance never fully returned, and she now requires assistance going up and down stairs. More than the physical effects, it was the emotional toll that lingered. She told me, "I thought I was doing the right thing. No one ever warned me." And that's the tragedy. Most seniors aren't warned. They see a bottle labeled "supports eye health" and trust it without question. The lesson here is simple but powerful. When it comes to fat-soluble vitamins like A, more is not better. It's riskier. You must know what you're putting into your body, especially when taking multiple supplements that might overlap. Ask your doctor, read the labels, know the difference between helpful and harmful. And most importantly, remember that protecting your vision should never come at the cost of your brain. Coming up next, a vitamin praised for heart health that may be quietly triggering sudden spikes in blood pressure and brain vessel spasms. You won't want to miss it. Part 5. Niacin Vitamin B3, the cholesterol fix with stroke risks. Niacin, or vitamin B3, has long been promoted as a heart-friendly vitamin. It's praised for its ability to lower cholesterol, improve circulation, and support metabolism. For seniors concerned about heart disease, niacin often feels like a smart, natural choice. But beneath its healthy reputation lies a hidden danger that few talk about. High doses of niacin can trigger dangerous swings in blood pressure, cause sudden vessel constriction in the brain, and quietly raise your risk of stroke. Let me tell you about Dennis Alvarez, an 82-year-old retired postal worker from Florida. A cheerful, energetic man. Dennis believed in doing everything he could to stay healthy. He didn't want to rely on prescriptions, so he purchased a heart support supplement online that promised to lower cholesterol naturally. What he didn't realize was that it contained 1,000 milligrams of niacin per serving, and the label recommended 2 servings a day. Within a week, Dennis began experiencing intense facial flushing, pounding in his chest, and dizziness upon standing. At first, he thought it was anxiety. Then one morning, his speech slurred for 2 minutes, and his wife noticed he couldn't focus. He had experienced a transient ischemic attack, a mini-stroke. What was happening inside his body? Niacin causes blood vessels to dilate, which explains the flushing sensation. But afterward, those same vessels constrict. For a healthy young person, this rebound might not matter. But for seniors with aging arteries, high blood pressure, or pre-existing cardiovascular issues, these fluctuations can strain the heart, reduce brain blood flow, and trigger vessel spasms that lead to stroke. What makes it even more dangerous? You don't need a prescription to buy high-dose niacin. Many supplements market it as flush-free. which delays symptoms but not the risks. It's often added to combination products without clearly listing the dosage. Early warning signs of niacin-related issues include warmth or redness in the face and chest, sudden headaches after taking supplements, irregular heartbeat or palpitations, morning dizziness or mental fog. Here's how to stay safe. The recommended daily intake of niacin for seniors is about 14 to 16 milligrams. Avoid anything over 50 milligrams unless prescribed by a physician. Never mix niacin with cholesterol medications or blood pressure drugs without supervision. Monitor your blood pressure closely if you take any form of niacin. Dennis is now recovering. He no longer takes over-the-counter supplements without medical approval. He's lucky his mini-stroke didn't leave lasting damage. But it shook him. "I thought I was helping my heart," he said. "I had no idea I was hurting my brain." And that's the key lesson here. What supports one part of the body can strain another. The heart and brain are deeply connected, but they don't always agree on what's helpful. Niacin may lower cholesterol, but at high doses, it can destabilize your entire vascular system. Be vigilant. Read the fine print. Ask questions. And as we move into the final section, I'll reveal how to fuel your brain not with pills, but with real food, the kind that naturally reduces stroke risk and supports long-term cognitive vitality. You won't want to miss it. If you've made it this far, you've already taken the first step toward protecting your health in a powerful way. You now understand what so many people never hear, that vitamins, even the ones marketed as safe, natural, and essential, can quietly become dangerous, especially as we age. Every story we've explored today had one thing in common: good people trying to do the right thing who were unknowingly sabotaging their health. They weren't reckless, they weren't careless, they were simply uninformed. And that's why awareness matters. It isn't just knowledge, it's a power, the power to question what you put in your body, the power to speak to your doctor, the power to read the label and pause before assuming that more is better. After age 60, your body becomes more sensitive. Your liver processes nutrients more slowly. Your kidneys filter less efficiently. Your blood vessels are more fragile. That means even small daily choices, like when you take a vitamin or how much you take, can create long-term consequences. Let me leave you with this. Prevention doesn't always come in the form of a pill. Sometimes it comes from asking the right question. Sometimes it means less, not more. And sometimes it means replacing supplements with what your body was built for all along: real food, quality rest, hydration, and regular movement. So here's what I urge you to do right now. Go through your supplement cabinet and read every label. Talk to your healthcare provider about your dosages and possible interactions. Avoid high-dose supplements unless medically necessary. Choose food first, whenever possible. Your body knows what to do with real nourishment. And most importantly, share this message. You may not know it, but someone in your life, a friend, a neighbor, a parent, could be one pill away from disaster without even realizing it. If this video opened your eyes, let it open someone else's. Like, comment, subscribe, and pass it on. Because the best medicine isn't always in a bottle. Sometimes it's a warning that arrives just in time. I'm Dr. Jen. Thank you for watching. Take care of your brain, take care of your future, and never stop learning.